there's this moment, a kind of cold clarity that
Yeah.
anyone who's struggled with compulsion, they just know it in their bones.
Mm.
It's that split second right before you do the thing you know is going to harm you. Logically, you know it.
But the urge is physical.
It's completely overwhelming. It just screams louder than any rational thought.
Mm.
And it can leave you feeling like you've had a total failure of character, a moral failing.
And that feeling of losing control, that's exactly what's fueled the stigma around addiction for generations. We used to frame it as just a weakness of will.
But that viewpoint really starts to collapse when you look at the last few decades of neuroscience.
It really does.
So our mission in this deep dive is to move past that old, damaging idea. We're going to look at the solid science that shows addiction for what it is, a chronic biological condition.
This is your shortcut to understanding the physical reality of it all.
Okay, let's unpack this. Here's the simple definition. Clinically, addiction is defined as compulsive seeking and use of a substance, despite knowing there will be negative consequences. That pattern, that drive against your own self-interest, that's the core of what are called substance use disorders.
And we should probably reset the language right here.
Good point.
Moving from words like addict to saying a person with a substance use disorder. When we see it as a chronic brain disease, like any other disease, it helps strip away that stigma.
It really does. And here's the core idea, the bridge from the old way of thinking to the new one.
Mm-hmm.
Addiction is not a character flaw. It's a learned brain-body loop.
And that learning is key. It physically changes the brain. When scientists call it a chronic brain disease, they're often using the 3 Ps: pervasive, persistent, and pathological.
So these aren't just, behavioral quirks. They're measurable, lasting changes in the brain's physiology.
Exactly.
And that's why the big diagnostic manual, the DSM-5, updated its entire approach. It got rid of the old categories of abuse and dependence.
Which were very loaded terms.
Very. And replaced them with a single spectrum, substance use disorder. Now it's evaluated on a single scale of severity, mild, moderate, or severe. It's all one continuum.
Okay, and before we dive into the actual brain mechanics, we have to be really clear.
Yes.
This discussion is for educational purposes only. It is absolutely not medical advice. If you or someone you care about is struggling, please seek help from a qualified professional.
Absolutely. This is complex stuff and requires real support.
Okay.
So let's get into the wiring. The mesocortical limbic pathway. It sounds complex, but it's really just 3 key areas.
Yeah.
The ventral tegmental area, the nucleus accumbens, and the prefrontal cortex.
Right.
Researchers call this the brain's final common pathway for reward.
So in real life, what does that look like?
It's basically a hostile takeover.
Yeah.
Your natural reward system is designed to give you a little pat on the back, a little squirt of dopamine for doing things that help you survive. Eating, connecting with people.
Good, healthy things.
Right. The dopamine says, hey, that was good, do that again. But then a substance comes along.
Mm-hmm.
And while every drug has a different way of starting, opioids hit certain receptors, stimulants block dopamine from being cleared away, they all end up converging on this one single pathway.
So they all funnel into the same spot.
They do. They hijack it. The drug doesn't just offer a reward. It unleashes just a massive, immediate fire hose of dopamine into that system. It completely overwhelms it.
Which is not what it was designed for.
Not at all.
Yeah.
And it overwrites the brain's ability to value normal, healthy things. It's a super stimulus that the brain just isn't equipped to handle.
Now, the important part.
Yes. So that explains the initial rush. But
Yeah.
why does willpower seem to fail? Why does recreational use sometimes tip over into addiction? The best explanation for this is something called the incentive sensitization theory.
And this is so important because it explains how the experience changes.
Right. It shifts from liking that initial pleasure, the high, to this really intense pathological wanting. What starts as pleasure becomes a compulsive drive.
Incentive salience.
Exactly. And this is where we learn dopamine isn't really the pleasure chemical. It's the motivation chemical. It's the signal that screams, pay attention. This is critical for survival.
And the brain tries to adapt to that.
It does. With chronic use, the brain tries to turn down the volume by literally reducing the number of dopamine D2 receptors in a part of the brain called the striatum.
And that reduction is a huge problem.
It's a huge problem. It creates what researchers call a reward deficiency syndrome. The brain is so adapted to the substance that a person is now driven to seek it out, not to get high, but often just to feel normal,
Just to get back to baseline.
or to stop the numbness that sets in when the natural reward system is basically offline.
Hmm.
And this intense drive starts to warp our control center, the prefrontal cortex.
The BFC.
Right. Addiction causes these long-term impairments in the PFC.
Why isn't willpower enough here?
Because the PFC is literally the CEO of your brain. It's what you use for inhibitory control, for weighing long-term consequences, for making sound decisions. If that part of your brain is biologically impaired, if the brakes are shot,
Then just choosing differently isn't really an option.
your physiological capacity for self-control is genuinely diminished.
Okay.
And we can zoom in on one specific effect of this. It's called delayed discounting.
Which is a kind of impulsivity.
Exactly. It's the brain's preference for a smaller, immediate reward, like using the substance right now, over a much, much larger but delayed reward, like health or stability or relationships.
It's like choosing $10 right now over $100 next week.
Except the $10 is toxic and the $100 is your entire future. The wiring itself starts to force that choice for the immediate small payoff.
And there's research to back this up.
Oh, absolutely. Studies on patients with lesions with actual damage to the ventromedial PFC show they consistently make riskier decisions. It shows a clear physiological basis for what looks like poor judgment.
That makes the short-term payoff feel much bigger than the long-term cost. The brain's cost-benefit analysis is literally broken.
Let's connect this to what you feel day to day. That whole cycle of compulsion and distress. We talked about the reward part, but the real pain of addiction comes from what's called the anti-reward system.
The allostatic model.
Right. The first phase is the reward, the high. But the later phase, that's the dark side. It's all about stress. Chronic substance use dysregulates the body's entire stress system. The HPA axis, stress hormones, all of it.
So when the drug wears off...
The brain doesn't just go back to normal. It plunges into a deficit. Your stress hormones are through the roof. This leads to a really profound negative state dysphoria and that anhedonia we mentioned, that aching inability to feel pleasure from anything else.
So it's not about chasing a high anymore.
A lot of the time, it's about desperately trying to escape that crash. That negative feeling is what drives the next round of compulsive seeking.
Is craving a thought or
No.
something else?
It's so much more than a thought. Craving is a learned, conditioned brain response. We call it cue-elicited craving. Think of it like Pavlov's dogs, but for your reward circuit.
So things in the environment can trigger it.
Exactly. An external cue, a place, a person, a smell, or even an internal one, like a jolt of stress, can automatically activate those reward regions in the brain. The VTA, the striatum.
And that triggers a dopamine release.
It does, but it's a dopamine release that feels less like pleasure and more like an irresistible motivation. An itch you have to scratch. The whole loop just reinforces itself.
So the environment starts pulling the strings.
It does. And speaking of cycles, this is a good place to bring in some crucial context about recovery and hope. Because addiction is a chronic disease, relapse is an expected part of the journey.
That's a really important mindset shift.
It is. The relapse rates for substance use disorder are statistically very similar to those for other chronic diseases, with a clear physiological component.
Like what?
Things like type 1 diabetes, hypertension, asthma. They all have one-year relapse rates, somewhere between 40 and 60% after treatment.
Wow.
We don't blame someone with asthma for having an asthma attack, right? We see it as a sign to adjust their treatment plan. The same logic has to apply here. And because it is so complex, that whole loop of reward, stress, and impaired control treatment has to be comprehensive. It needs medical, psychological, social, and even occupational support.
So recovery means managing a chronic condition, not just trying harder once. It takes a lot of external support.
Absolutely. The goal is long-term management. So based on everything we've talked about, the reward hijacking, the impaired self-control, the conditioned craving, we can pull out two practical things to think about.
Okay.
Two takeaways you can try today. Takeaway one, build a trigger map, cue and next move.
Because if craving is a learned, conditioned response, you have to be able to spot the trigger, the cue, before the whole automatic process takes over.
Exactly. Compulsion loves speed. So your job is to slow it all down. You map the chain. First, you note the specific cue. It could be a time of day, a stressor, a location.
Right.
Then you identify the feeling that comes with it, that restlessness, that tunnel vision, the physical sensation. And finally, you pre-plan a different next move, something to substitute for the automatic behavior. Awareness is the wedge you drive into the machine.
Okay, that makes sense.
And then takeaway two, add friction plus support plan.
This one goes right after the impulsivity, the delay discounting.
Right. Impulsivity thrives on easy, immediate access. So the actionable step is to add a deliberate barrier. Add friction. Make that immediate reward harder to get to.
Like what?
It could be as simple as physically moving the substance or the object somewhere far away, somewhere that requires real effort to get. Any delay you can create gives your prefrontal cortex a chance to catch up.
And the support part.
That's critical, because we know internal willpower is depleted. External support is the scaffolding you build around yourself. This is why peer recovery specialists are so effective.
They've been there.
They've been there. They help navigate the real-world challenges, housing, jobs, social life. So your actionable step is to create a plan. One barrier plus one person you can contact, plus a specific time or condition for when you'll use that plan.
So one barrier plus one person plus when.
Exactly. It's acknowledging that recovery is as much about that external scaffolding as it is about internal work. And that really is the core of this deep dive. We've seen how decades of research have redefined addiction. It's not a moral failing. It's a measurable chronic brain disease.
It involves learned pathways, dopamine, stress, and impaired cognitive control.
Pervasive, persistent, and pathological.
Right.
Full sources and further reading are in the description.
Okay.
Subscribe for the next episode. DSM-5 explained in plain English.
And here's a final thought for you to take away. We know from neurodevelopmental studies that the brain's highest control center, the prefrontal cortex, keeps developing and maturing well into your mid-20s. That long period of plasticity is proof of the brain's incredible enduring capacity to learn, to adapt, and to recover. It offers real biological hope for change, no matter how long the struggle has been.
Comment one word. Proof if you want season 2. Next episode is already waiting for you.